Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So Brad, we had a request.
Right. As you know, we've got a number of students that watch our videos, and this particular student says, are you going to do one on soap notes?
All right.
And both you and I, that it was a little bit troublesome, that it was for me.
Sure.
How do you do a
Getting
soap
started
note?
on.
Yeah.
And it's not the worst for people who don't, that aren't students. They can see how we document things when we're
Exactly.
talking about people.
And these soap notes are something that nurses use, OTs, PTs, a lot of people in the health field. And what do they mean by soap? We're talking about subjective, S, objective, O, A is your assessment, and P is the plan. Now, I'm not even going to go through this in a lot of detail, Bob, but these are things that helped me out when I started this to make them efficient and a nice clean note.
Can you read this okay, Lonnie, by the way?
Yeah.
We're at the right angle? Okay.
Yeah, it's my writing. It's not very clear.
Yeah.
That's why I dictate everything.
So subjective is first.
Right, and I always start out with this sentence. Well, it depends on the gender. A patient is a pleasant 41-year-old male with complaints of low back pain. It puts it out right away. You have a picture of who this person is. Sometimes I'll put it in there if they're slender, obese, or something of that nature.
Right, and you got the age in there, so you right away know where you are, demographically wise.
Exactly, and we know the basic complaint is low back pain, and we're not going to get specific yet. And then my second sentence.
So if they're unpleasant, do you put unpleasant?
Yes, you better believe I do.
All right.
It's important to know if the therapist next, who
Sure.
treats them next, is kind of prepared for that.
Maybe agitated you might put, or
Right.
different descriptive.
Be professional.
Yep.
Then the next sentence will be primary.
Objective?
No, I go to the
next
next sentence. I go to the primary part of subjective. Primary complaint of low back pain with sitting.
Okay.
And there may be some other things, but that's, so you get right to the point, and then you can add in some fillers if you want to.
Sure.
This is the way I do it. Bob can fill in how you like to do yours.
Sure.
Then objective, and this varies from therapist to therapist, but it's always things you can measure, very objective things like range of motion you can measure. If there's point tenderness, at what location, is it L4, L5, in the sacroiliac area. Neuro tests, if you're going to do some neuro tests with your reflex hammer. Manual muscle testing, you got some muscle grades, 4 out of 5, 3 out of 5. Other special tests. You got any other ones that?
No, that covers most of them. The objective tests you're going to do, especially with back pain. Now, if someone else had balance problems, then you'd be doing some balance tests and stuff like that.
Right.
So depending on the problem.
And then the assessment part. And this is where the first thing I always write down are symptoms are consistent with.
Right.
We are not doctors. We are
We're not allowed to diagnose.
Right.
So we can assess, and which means, again, he's saying this is acting like it could be this.
Right.
Right.
So it's a very clear way to put it, and it makes
Right.
it legally acceptable if you ever had to go to court.
Right.
You'd say, well, the symptoms were consistent with L5 herniated disc.
Right.
Okay.
We're not saying it is because we didn't have a
MRI.
MRI or CT scan, so.
Right, and then you may do a little more, a few more sentences to carry details out on that. And then goals I like to keep in the assessment part or just after that. I like to keep it down to 3 goals. Some people do more. A nice one if it's an outpatient.
Some people might put short-term goals and long-term goals, right?
Right, yeah. I usually do 3 short-term and 1 long-term.
Sure.
Other people do more. This is simple. The first one for an outpatient, demonstrate independent home exercise program. Almost all people need to do that.
Right.
It's an easy goal and it's worthy. Next one, in this particular one, sit greater than 20 minutes without low back pain, function. Okay, I'm not going to say patient able to flex more than 30 degrees forward without back pain.
And really, quite often, you want to have the goals really oriented towards function as much as possible.
Because
insurance companies
don't care if you can flex up to 60 degrees without pain, but they do care if you can sit for more than 20 minutes.
Or pick something off the floor.
Right. Especially if the person works at a job where they sit all the time.
And the short-term goals probably should be something you can reach within like 1 to 2 to 3 weeks.
You're
maybe.
right, yep.
Right.
And then the last one, I put another example, to put shoes on in the seated position.
Sure, again, functional tasks.
Right,
That's what you want to think, function.
Right. I'm not going to put patient be able to touch toes in the seated position because why would you touch your toes? But you do need to put your shoes on
That's
every
exactly
day.
right. Yep. The last one is plan.
Plan, and this is how are you going to get there? In this case, progression.
How are you going to get to your goals?
Exactly, right. In this case, progressional lumbar extension range of motion. And then another, educate patient on biomechanics and posture to help reduce pain and symptoms in the low back. You may, if you want to use ultrasound or you're going to do some mobilizations, you'll put that in there. And then you may, I didn't put it on here, short-term goals to be met in 1 to 2 weeks, long-term goal to be met in 4 to 6 weeks.
Very good.
So there you go.
All right.
Soap has nothing to do with cleaning yourself. It all boils down to right here. So if you're a student and you want to be a soap master, here you go.
You've come to the right place. Thanks a lot.